All right, we're having a discussion here about antiarrhythmics. So first of all, let me explain a little bit about what they're even talking about, okay? So in your heart, and really in all muscle, there is like this is 0, let's say. So this is the cell membrane, okay? Well, that's not the cell membrane. This is representing the electric difference between the extracellular membrane and the intercellular membrane. And when there are on the membrane, there are these little channels, and these little channels are going to open up only when the membrane gets to a specific electrical potential. Let me try to explain that again. So here's a cell, okay? This cell serves some kind of function. Let's say that it is a muscle cell. So it's going to, like, you know, it's got all these things in here, whatever. Yeah. Anyway, point is that on the cell, there are these little channels that are closed. These voltage-gated channels stay closed until the voltage gets to a certain level. Now, what determines the voltage? The voltage is the difference in ion, positive charge and negative charge between the outside of the cell versus the inside. So let's say here you've got lots of positively charged ions inside and only a couple of positively charged ones on the outside. There's going to be a higher positive charge here than out there. And so this would have, some specific voltage. Maybe it'd be positive. Maybe it'd be like positive 30 millivolts, whatever, But if you had less in here and you had tons out here, it might be negative, like negative 30 millivolts, whatever. So the amount of sodium or potassium or calcium that's coming across here is going to determine this voltage. And if the voltage gets to a certain level, a trigger point, then what's going to happen is this voltage-gated channel is going to pop open, and you're going to get tons of positive ions flowing in. And when all those positive ions flow in, they're going to cause this cell to do something, to have some sort of reaction, okay? So that's kind of how it works with cells. So now let's apply this to the way that the heart works, okay? So in the heart, if you were to look on an electrocardiogram, the whole conduction system of the heart works with these ions, okay? And if you block certain ions, then it's going to have certain effects on the heart. So when you look in a heart, you can see its electric activity. You can track it with something called an electrocardiogram, ECG, or sometimes they call it EKG for a different language. And on there, if you look on like one of the leads, so there's different places they put these leads to track the electrical potential as it's traveling in different directions according to the vectors, just what direction the electrical force is going. Not the point of this discussion. So you'll see, they'll go along and they have this little P wave, and the P wave is the atria contracting, and then you're going to have this QRS complex, which is the ventricles contracting and the atria repolarizing, and then you're going to have this little ST segment there, and then you're going to have a T wave, which is the ventricles repolarizing, and then the little thing's just going to repeat again. A little P wave, and then a QRS complex, and then, it's just going to keep doing this over and over and over and over again, okay? That's kind of how it works. So sometimes in the heart, let's say the heart's not getting enough oxygenated blood because you have atherosclerotic plaques that are preventing it from getting enough, and it's suffered some damage, and the heart thinks that you're dying, okay? It thinks that you're not getting enough oxygen. Maybe it thinks that you're bleeding. I mean, the heart doesn't really think, but you get what I'm saying, okay? So hopefully you do. So anyway, so the heart is kind of freaking out here, and sometimes the heart thinks I'm going to die unless I really pump super hard and super fast and get my limited amount of blood through my whole body to keep my brain alive. But that's not really what's happening. What's really happening is that you've had, maybe a stroke or myocardial infarction, or you have some sort of issue, some other problem going on. I don't know. I'm probably not doing a very good job explaining this, but basically get the idea that something bad happens and your heart will have something called an arrhythmia. Okay, this is a rhythm. A means without. Okay, so the word really means without a rhythm, but in actuality, an arrhythmia means like a bad rhythm. Okay, so the rhythm of the heart's bad. Maybe you have tachycardia, where it's beating too fast, okay? So it's like, going through this whole process really quickly. Or maybe it's having, some other issue where, I don't know. There's lots of things that can happen, okay? So what we do to treat some of these arrhythmias is we give drugs that block the channels of the flowing of ions within the membrane potential, okay? So I'm just going to keep that up there, even though this is not the same thing as I'm drawing now. So this is kind of how it works, if I remember correctly. Hopefully I don't screw this up. I did not review this before I started talking. So normally the membrane potential, this is 0. Normally the membrane potential is somewhere down here. I don't remember where. Let's just say negative 60 millivolts. Okay? And there is going to be a trigger of some kind. A signal is going to come down, and it's going to start sending sodium into the cell. So the sodium, here's that membrane thing here. Here's the inside of the cell. Here's the outside. Here's the membrane. Okay, so sodium starts coming in. Sodium coming in. So lots more positive sodium ions come in. And so that as the positive ions come in, that membrane potential increases. Okay, it increases, it increases, it increases, it increases. And it passes that threshold, where it triggers, whatever. And when it triggers like this, it's going to get kind of the top until finally there's so many sodium ions on the inside that this thing wants to balance out. So what it does to balance out is it lets out its potassium channel. So in here is also potassium. I should have backed up. First of all, to say, when it starts out, because of the sodium-potassium pump, there's lots of sodium on the outside, and there's lots of potassium on the inside. Okay, that's how it started out. So when these sodium channels opened, they allowed the sodium that was on the outside, because things like to go from areas of high concentration to areas of low concentration. So all the sodium on the outside flowed into the cell. And after all that sodium comes in these fast sodium channels, then what's going to happen is it's going to now release its potassium, because it has tons of potassium in the inside, high concentration. And so this potassium, I think they're slower. I can't remember all the details. I apologize. Calcium fits in here too. And so now potassium is going to start to flow out of the cell. And as potassium flows out, potassium has a positive charge. So here comes the potassium out of the cell. You're getting rid of some of these positive charges, which means you're getting rid of some of the voltage. The voltage is going back down again, and it's going to go down, and then it's going to stay at this resting potential, and then at some point it's going to get activated again, and there's a whole conduction system in the heart. It's kind of complicated. I'm not going to go through all of it right now. It's actually not that complicated. It's not too bad. But anyway, there's more to this than just what I'm showing here. Okay, there's also calcium, which kind of prolongs this. Anyway, for this discussion, not important. The point is that we mess with arrhythmias by inhibiting the channels of sodium and messing with channels of potassium and also calcium. All right? So we try to fix these arrhythmias by messing with the channels for these ions, because if you can't let some of these ions in or out, it's going to slow down this whole conduction process, okay? So let's start out here talking about procainamide. So one thing I notice is that all of the class 1, no, I'll put it this way. First I'll give you the big picture. Okay, we've got Procainamide, Lidocaine, Flecainide, Amiodorone, and Ibutilide. We have some more too. They're the class 4 calcium. I'll discuss those in a minute. So these three here are all class 1. Class 1 means that they deal with sodium. Okay, so these guys all do sodium, sodium, sodium. And what do? They are sodium channel blockers. Okay, so when there's all the sodium is out here, right? And you got these little channels here, and these channels allow the sodium to come in. What these drugs do, now as it comes in, that's going to cause this membrane potential to rise, which is going to trigger another one of these, whole things going on here. So what this does, what Procainamide does, is it goes here and it blocks this sodium channel. So now sodium can't come in. If sodium can't come in, then the membrane potential can't rise. You won't have an action potential, which means that the heart isn't going to fire. Now, it's not that it's not going to fire, period. It's just going to slow it down. Because in the case of this, we had the heart beating really fast, really fast, really fast. When it beats really fast, it's going to kill itself because it's going to run out of oxygen. It's going to run out of ATP. It's going to have higher, and then it's becoming ischemic, and it's going to get all worn out, and it's going to die. Okay, so you've got to slow the heart down. You need to stop it from doing this, or else it's going to kill you. So now this sodium can't come in. Now it's not that it can't come in at all. It's just that it slows it down. It can come in another way, but it's just kind of the whole process is slowed down. So now this person is taking this sodium channel blocker, and their heart's going to slow down because it's not going to fire as quickly. So that's Procainamide, also called Procan SR or Pronestil. Okay, so it's an antiarrhythmic. I'll read a little bit more about here. So it's a class 1A. Maybe you can remember 1A because A is the beginning of the alphabet and pros are number 1. So pro and A, number 1. So I'll just read what it says. It says Purkinje cells. Now, Purkinje cells are cells that transfer. They're kind of like self-generating. I might as well show you. Here's a heart. Okay, you've got SA node and AV node, and then you've got the bundle of His, and then you got these Purkinje fibers down here. And this is kind of what Purkinje fibers are kind of what trigger the ventricles to contract, whereas up here these cause the atria to contract. So down here, Purkinje cells are like specialized muscle cells that have this kind of auto-firing ability. Okay, so it says Purkinje cells, moderate I sodium channel blockade, depressing phase 0 depolarization, which decreases conduction velocity. It says blocks potassium channels, prolonging repolarization. Okay, so great, good deal. So when do you use it? It says you use it in emergent treatment of wide complex tachycardias. So if a person has a tachycardia that's out of control, their heart's going really fast, it's going to kill itself, you give this to them, it blocks out, slows it down. All right, Procainamide, done. Now we're going to talk about lidocaine. So we talked about Procainamide. I'll leave it up there. What the heck, might as well. I'll erase it later when I have to. Lidocaine is a class 1B sodium channel blocker. So it does mild sodium channel blockade. So you use it for treatment of acute ventricular arrhythmias caused by myocardial ischemia. So if a person has in their heart, the demands of their heart become really high, there's not for oxygen are really high, it's not getting enough oxygen, the ventricles become ischemic, which means they don't have enough oxygen, not enough blood carrying oxygen, and in that case, that can sometimes trigger an acute ventricular arrhythmia. So that means the ventricles, remember this part here represents the depolarization of the ventricles, so that part right there is too fast, beating too fast, all right? So if the person has that, you can give them lidocaine, also called xylocaine, XYLocaine. It's also used, and you've probably heard of this, as a local anesthetic. You can take some lidocaine, inject it in your mouth, and then you're not going to feel this whole area because, remember, also you're sensing, your nerves also work through this whole process of firing and action potentials. And if you stop that in that area, then there's going to be no pain signals coming from this nerve going to your brain and saying, ouch, the dentist just ripped my tooth out and cut my gums open. You're not going to feel it because this signal will never be sent. So that's how it also can be used. All right, so that was class 1B. Now we're going to go to class 1C. Flecainide. I noticed they've all got cane in them. So this is, first it was Procainide 1B, Procainide 1A, Lidocaine 1B, Flecainide 1C, but all using sodium. So this is for class 1C antiarrhythmic, marked sodium channel blockade. Purkinje cells, yeah, this looks like the same thing. I don't honestly know, but I guess it's used for the case of supraventricular arrhythmia. So supraventricular, supra means over, I'm assuming. So here's your atria, here's your ventricles. You had your, your nodes here, and then you have your bundle of His going down. You've got these Purkinje fibers, your fascicles here, your right and left fascicle, anterior, posterior fascicle on your left side. Okay, so all that stuff's going on here in your heart. That's great. So this is going to be a supraventricular. So here's your ventricles. It's going to be a arrhythmia that's caused above your ventricles, so up here somewhere. Supraventricular. So your nodes, AV node, SA node. I think it goes SA node, AV node, but I don't remember. Oh well. One thing I need to know, I need to look into. So for example, a condition called Wolff-Parkinson-White syndrome, that's where essentially this little trigger for the ventricle to fire happens a little too soon. Sometimes you notice they have like this little kind of thing like that, no Q wave. In patients with structurally normal hearts. Okay, so very good. Now we're going to talk about Amiodorone. Okay, so this whole time we've been dealing with sodium. That's great, sodium. All right, now we're moving on to potassium. Okay, and I thought of kind of a silly way to remember this. So I know I put 3s here because class 3, but I'm going to do 3 a little bit differently. I'm going to do 3 like this. And that looks like 3, and this is maybe a little bit yucky, but sometimes yucky helps you to remember things. That's a 3. Pretend that these are actually butts. The 3s look like butts, okay? And how did I work on this before? So I had Ibutilide, so that's Ibutilide, and I also had Amiodorone, because butts have an odor, okay? And the point of this is to help you remember that Amiodorone and Ibutilide are 3, class 3, and class 3 works with potassium, okay? And here's the thing about potassium. If you write out the word, let's erase this K here. I'm going to write out the word potassium, and you're going to see that potassium also has a but in it as well. Okay? So there it is. Oops. So a 3 is a but, another way of saying but, and then over here has an odor and Ibutilide. So that'll help you remember these together. Hopefully, maybe, we'll see, probably. Usually the weirder it is or it has to do with butts or something, it's easy to remember. Okay, so these are class 3 antiarrhythmics, potassium channel blockers, prolonging repolarization. Okay, now this cell can't fire again unless it kind of recocks like a gun, okay? It has to get down here again before it can fire again. So in this case, remember the sodium, this going up represented the sodium coming into the cell, sodium in, and this represented potassium going out, okay? So in this case, what we're doing is we're blocking the potassium from going out, okay? And so if you block the potassium from going out, it's going to prolong the repolarization. This period here is called the repolarization. It's repolar. Polar is when you go far away from center. So down here is a pole, it's a polar, so it's repolarizing. This is depolarizing, going away from the pole towards center, towards positive, and this is repolarization, going back towards one of the, polarizing again. So this prolongs repolarization. So from going from here to here, it's going to prolong that because you've blocked. Here's the membrane. This is the inside. That's the outside. You're blocking these. So first of all, remember all the potassium, the sodium came in, and now you're blocking that potassium from coming out. So it can't come out. So it stays in for a while, and so you're going to stay up here longer. And if you prolong this, it's actually going to slow this down as well. So what do you use these for? It says you use it for ventricular arrhythmias. It says it's the drug of choice to treat VT over VF. I don't remember what that stands for. Although it can be used to prevent ventricular arrhythmias, implantable cardiac defibrillations have emerged as treatment of choice. Also, you can use it for atrial fibrillation. So atrial fibrillation is where your atria is fibrillating, where it's like just going really fast, and you see, atria, this is the atria firing here, so that's firing too quickly, and it's initiating the whole process over and over and over again. So you can take this Amiodorone, this guy right here, you can take Amiodorone in the case of ventricular arrhythmias and atrial fibrillations. Also, apparently one of the side effects here is, that it increases the QT interval. So what's the QT interval? So going back here, we have the P wave, Q, R, S, and now the T. So it prolongs the space from here to here, which makes sense because you've blocked this, so this is going to go whoop, out to there. This whole process, yeah, makes sense. Sometimes it can cause torsade de pointe, where that's where it goes all crazy. And it looks like sometimes it can also cause the thyroid dysfunction, but I don't know why. Good to know. So there's Amiodorone. And Ibutilide, also called Corvert. This is also class 3, same thing, potassium. Looks like you use it for cardioversion of atrial fibrillation or flutter. So you use this guy in the case of atrial fibrillation or flutter. Basically, these look like, if you look on an EKG or ECG, you'll see, you get like a flutter is where the thing's just kind of not firing, it's just kind of going crazy. Yeah. Okay, now we're talking about maybe actually I'll stop there and I'll pick up these other ones on the next video. This is already pretty long.